Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, it's great to see you. It's good to have you back with us. Really excited because we're bringing some incredible conversations with some just really phenomenal leaders that are in our space that are painstakingly just shaping the future of healthcare. And we're really passionate about a few different areas. We're passionate about healthcare leadership. We're passionate about access and innovation adoption. So if you haven't been with us before, let me just sort of take a quick step back to tell you what we are trying to do here. So we're focused on bringing real stories of people to life that are actually innovating, getting really good stuff done, not just sharing the wins, also sharing a lot of the learnings. And if you haven't checked out any of the historical interviews, make sure wherever you are, just hit the subscribe button now, and all of our new interviews go right to you. So the field that we're in is constantly evolving. It's shifting, it's changing right beneath our feet. And it's crucial to have leaders that envision a future differently. They are eagerly embracing innovation and they want to address these pressing challenges. And we have no shortage of challenges. And today we're going to be focusing in on workforce challenges. Our next guest on the show is a visionary leader. She's an operator, she gets it, and she's actually transforming the workforce, how we're doing it today. So, Jessica Sylvester, she is the CEO and founder of Humla Health. So, Humla Health is really revolutionizing healthcare staffing by leveraging technology to directly connect nurses and healthcare facilities. So, the platform in my layman's terms, it reduces staffing costs that come by using traditional agencies and it's essentially really eliminating that middleman. We'll dig more into it, but Jessica is not new to running and managing teams, especially big teams. Before she started Humla Health, she was the director of emergency services at Hennepin Healthcare. She led her team through some just really difficult challenges, and we'll go into that a little bit today as well. But her commitment extends beyond just her professional career. She's got a passion for nurturing the next generation of healthcare leaders. So we connected on that. It's just you're going to be really impressed with her, and her involvement is also around the Minnesota organization of leaders in nursing, and she's just had a lot of contributions that's made her a pivotal figure in educating and inspiring future nurses. So today, Jessica's going to join us to share some moments of her inspiring journey, not just the highlight reel, also some of the other parts that people usually cut up and never, showcase. We're going to bring some of those to surface. So, Jessica, it's great to see you. Welcome to the show.
Thank you, Michael. And thank you for being gracious and kind, and then giving me the opportunity to connect with you today. Very appreciated.
Yeah. So let's just kind of dig in. So I mean,
Yeah.
you're
Sure.
from nursing to the boardroom. Your journey's been both inspiring and unconventional. So what
Yes.
was that pivotal moment that propelled you from hands-on healthcare to envisioning a tech-driven solution with
Yeah.
Humla Health?
Yeah. Great question. And, you know, this might resonate with people listening, right? None of us came out of COVID unscathed. For myself as an individual and leading a big team in Minnesota, one of the trauma centers, right? Experiencing the boarding and throughput issues that we were having every single day. And how that was impacting patient safety outcomes, but then also watching agencies, recruiters, MSPs, VMSs, HR, like either not aligning with like getting the needs met right like when we needed it, but then artificially inflating our costs where they didn't necessarily need to be, and that all translates down to us as consumers of healthcare, right? And
Right.
recognizing like for us as nurses, like we account for systems like a good chunk of their overall expenses. And, if we can create efficiency to get the right nurse in at the right time at a cost sustainable price for systems, we have the opportunity to make a significant difference in our ecosystem.
So was there a specific moment or a realization where you knew you're like,
Oh,
all right, I need to start this? Like,
yeah.
talk me through the thinking through some of that.
Yeah. Well, there was a handful of systems that had this life experience, but us in particular, we ended up having to bring the Department of Defense in to supplement our staffing because our workforce needed the support. And I think watching, wow, this can be done in the turnaround time for getting people in the door and for them to be effective, and give us the support that we needed was like kind of, it gave me that awareness like, wow, there's a lot of inefficiencies in how we run on a day-to-day basis.
Hmm.
And there's opportunity for us to, create something like this for a day-to-day use in nursing.
Hmm. Hmm.
To either be a surge plan or combat those emergency situations, but then also to remove all of those layers that don't necessarily serve, um, you know, like a purpose or like
Yeah.
using technology to think through this in a different way. We are in a pivotal moment in history where we have the capacity to leverage technology to streamline or create efficiencies where we haven't been before. And so, myself and other nursing leaders basically looked out into the tech world, different modalities, and we're like, all right, these are our workforce issues. This is the problem that we want to solve. What exists are out there in that space? And
Mm.
looking at ride sharing like Uber, Lyft, dating websites, VRBO, Poshmark, Rover.com, which yes, it's a dog sitting business. But it was like, okay, what are proven methodologies out there in the world to, create that effectiveness and that efficiency and be cost
Yeah.
sustainable? And also combat burnout, right? And why this matters. I think it was like 13% of the nursing workforce left last year. And I think the last data point I had seen was like 33%, somewhere around there, of new nurses leaving, and we have an aging workforce. And so again, um, we have to keep our peers, old salty dogs like myself, in nursing and in a different, like, how do we think through this in a different model?
Mm. The way that I think about it is you could have just as easily taken a traditional healthcare executive role, and yet you
Mhm.
chose to build something meaningful from scratch. What what's been the hardest part about transitioning from operator to founder?
Ooh, there's a lot to unpack there, Michael. Oh my goodness. Holy moly. Um, Well, I mean, I'm functioning as an operator in a different way. What I'll say for other people who have worked in their space for a really long time. Like I've been a nurse for 20 years, nursing assistant before that when I was a teenager. And you know where those gaps are. And, wanting nursing to be at the table to help solve some of these things where historically maybe we haven't always been brought along in that conversation.
Mm.
And I think we can be scrappy and innovative and like we know what we need, but like going out into the environment as a founder to bring it together to execute in a whole different other space. So I probably share that DNA with other founders or innovators is just like letting go of your day to day and just jumping for it and going for it. Because you know the gaps that need to be closed, but like, how do you go about it? But, you know, I would say for people in this space, get ready to be uncomfortable. Being an early stage founder or leader is wildly uncomfortable.
Yes. Yes, in a sense building a company means building a team, and you've built teams before. What
Yeah.
what's your non-negotiable in terms of when it comes to being on the team, when it comes to hiring someone? What is that non-negotiable?
Um, Alignment with the mission and vision and what we're driving for, where their heart is and understanding what we're solving for, right? Because I think that's a pretty good indicator for engagement as well.
Yeah.
And culture. Admittedly, I think that I had the benefit of having really amazing mentors or leaders in the journey of like an amazing team can accomplish amazing things, and we have an incredible team of engineers and nurses at the table doing this, and that they're good culture fit, right? And that we balance each other out well. And so, kind of inventorying where our weaknesses and our strengths are and how we balance off of each other is, I think one of the most important things as for myself personally as a leader.
You mentioned mentors and influencers. I'd be remiss. I mean, who are the mentors or some of the figures that have profoundly influenced you or impacted you? Any that come to mind, maybe that you just want to sort of shout out?
Oh man. Probably my very first nursing leader, Sue Henderson. Um, she was really good at being thoughtful around team building and bringing other people along in conversations to find out where the win-win was for people. And like making sure you bring your users along in the conversation too. So I have thought about her many times in this process, and I think one of the reasons that we've been successful to date too is our team has built this alongside our facilities and our nurses in
Mm.
understanding, like, okay, Jessica Sylvester might have the idea what the problem is, but like, in developing a product, like, is it user friendly? Is what we're building really solving the issue and getting that direct feedback from both people? Um, I mean, she was my leader like 15, somewhere maybe more years ago, and like
That's
that's
amazing.
reliable today. So, it was solid advice. So, and she's just an amazing person.
Wherever you are out there, big shout out to you. Thanks for that. Kind of digging into Humla's model. Just want to touch on that for just a few moments. What I thought was interesting is that you're ensuring that nurses remain W-2 employees and not just gig
Mm,
workers. Why
right.
is that distinction so important? And then how do you think, what are sort of the downstream effects of that?
Totally. Again, us looking at what has worked in other spaces, and where like do employees seem to be the most satisfied? Data like experiences seem to align more with W-2.
Hmm.
And then I think about like the health of employees for the long game. Let's say, this becomes an alternative model for nursing to combat burnout, and they start to do this as a full-time thing for them. And how they manage and take care of their own health and their family, but then also like it's also about their family and how we take care
Hmm.
of our loved ones and benefits, right? Like, what does that look like in the future for this to become a different modality for nursing to work through this space? Um, and, I think again, I'm going back to user experience, for what is the easiest, like overall solution that's helpful for systems and not like creating chaos. It's systems and nursing is that W-2 vein.
Interesting. And I
Mhm.
started digging into the name Humla,
Oh,
and I'd be remiss if I didn't say that it's Swedish for bumblebee. And if
yeah.
there's one, I don't have the exact quote, but it's basically saying the bumblebee flies, not because it doesn't actually know that it shouldn't fly, but yet it does. I guess what's the impossible thing that the team, that you're trying to achieve, and yet people are saying that it can't be done?
Ooh, yeah. Well, Humla, yep, like you said, stands for honeybee. And, how we played off of that is nursing. I mean, we're not the only workforce that is combating
Right.
burnout and looking for sustainable solutions. Kind of like bees, right? Like they need an alternative mechanism to be thriving in ecosystems. And
Mhm.
what we are building, we that's one of our missions and our visions is like how do we create that sustainable space for the our peers to thrive in the future. Um, and so there's that. But the impossible, you know, I feel like we're already starting to live that out in, how we're supporting rural care in a way that people haven't been able to
Right.
penetrate
Right.
just because, I think our how we're creating this, we've been very thoughtful around pricing and making this accessible and that access, like, so people that maybe normally wouldn't have access to something like this can afford it, or getting those critical nurses out to spaces that they wouldn't have. Um, and, just again, doing something in an area that's high risk, high reliability, like airlines, right? This like
Yeah.
has to be done really well. And this is pretty progressive, right? It's just something new. And so I think getting something off the ground that's really progressive right off of the bat, people are like, there's no way that this is going to happen. But we are, and we're gathering significant data in partnership with our systems and how that, how it's impacting them for good.
Yeah. And where are you guys now? I mean, can you share a little bit about um, just the journey around customers, successes, where you're seeing little wins?
Mm-hmm. Yeah. Our first adoption has been in Minnesota. Born and raised there, northern Minnesota. Give a shout out to Grand Rapids, Minnesota.
Right
Um,
on.
yeah. And that is, it was very surprising that our first adopters were, um, pediatric psych and rural right out of the gate. And I'm not gonna lie, I'm like, oh God, right? Like a really nichey, like specialized areas or, areas that are not like, how do we get people out to some of these care areas? And frankly, it was like it worked right out of the gate for both. And kind of that testament where I'm like, okay, if this can work here, like really like this is doable, right?
Yeah.
And so that's where some of our early wins were and starting to scale out into other states, right? And again, like that rural area, I mean, really meaningful conversation that I'd had. There was a nursing leader in one of these small towns who was like, we had actually reached out to a lot of players in the space and nobody would call us back because essentially we were told nicely it wasn't worth their revenue and that they were too expensive for us.
Mm,
Um, and so, being able to right out of the gate, like meet their needs and then get them nursing care, because we have programs closing. And I know that that issue is not exclusive to Minnesota, right? This is like nationally an issue where you have labor and delivery programs closing up or like psych programs, this is
yeah.
supporting nursing migrating, in a way that we haven't been before, or surge planning in the event of an emergency situation that it hasn't before. And so those have been some of the early wins that are like validated of like this has not been easy, but it's been worth it.
I mean, listen, you've been in some pretty crazy situations running an ER. I'd imagine there's no shortage of stories there.
Mhm.
What's harder, running an ER during a crisis or running a healthcare startup?
Ooh. You know what? Probably, I mean, I'm going to give you a very mom answer. They're both, they're both special in their own way. Okay.
Okay.
Um, I mean, hey, like going back to ED experiencing, that's a whole different emotional journey like of joy and tragedy that, hey, a startup might be hard, but it's not like anybody's going to die, right? So it's just like when you deal with nursing and people's greatest like these things directly impact like the core of their people. And I
Yeah.
mean, of course, startups are too, but you know, it's just more around like startups are like that journey of like building something. Um, but if I were honest, nursing in itself or all of those other people in healthcare at the clinical is harder, right? It's labor intensive, it's an emotional journey. You're dealing with crises or people's day-to-day lives, and that's hard. So
It is
actually,
hard.
I'm actually retracting my mom comment
Okay.
as thinking it's hard because, at the end of the day, when you're a nurse or you're a physician or like, I watch those people and it's just like, man, there's special people. And not that startups aren't, but um yeah, there's just something about the human capacity that is not it's you can't experience for your unless you've done it yourself in a hospital or somewhere else.
Well, thank you for just being rigorously honest about that. You mentioned something about being a mom. You're a
Mhm.
founder, you're a mom, you're a leader.
Yeah.
What's the hardest lesson in trying to balance all those identities?
Well, I think I've kind of adopted, and I learned this maybe in my grad school program and getting my MBA, like we're assigned to cohorts, right? And it's like perpetual motion or, I just am more thoughtful with my time because I am all of those things at the same time, all day long. And just being more thoughtful with my time. And like when I'm with my kids, it's dedicated, thoughtful time. And they have my full attention. And when it's Humla time, it's Humla time. But I'm always like those things are always on my mind. But I think when I think about myself as a mom and my daughters, you know, whatever the end game is for Humla, for them to watch, I feel like me, whether this is a wild success, which it's, it so far has been good and we're like incredible growth. I just like want them to see like it's okay to like step into the unknown or something you're afraid of and just go for it and that they can do this too.
It's pretty amazing. What's the best way that people can follow Humla, your story? Give us a little bit of a snapshot, a little commercial.
Yeah. Yeah, absolutely. Ooh, well, please engage with us on social media. LinkedIn, Instagram, Facebook, Humla.com. So, all good ways to get a hold of us. So,
Awesome. And then let's finish up with a little rapid fire, a little fun rapid fire so that we can finish this off on a really fun note. So you have to pick one. There's no
yes.
dodging in this. The most overhyped healthcare trend right now.
Ooh, ooh, that's a hard one. Jeez.
Well, you were just at this conference and there was a lot of talk about something. Do you think that was overhyped?
Ooh, this one may not be popular for me to say because it's gonna sound like I'm talking out of both sides of my mouth. Maybe
It's
not
your
over,
episode. It's
huh?
your episode. You can do whatever
Ooh,
you want.
it's not gonna be overhyped. It's not going to be overhyped, but I think about application with nursing. Somebody had said something to me that was really intriguing about AI eventually replacing nursing. And, I obviously am very, like, I love innovation. I love, like, we ourselves are in that space, right? Um, but there was something that I thought about, about like where's that happy medium? And the thing with nursing in particular, it's like there's so many soft skills that go along with nursing that I don't think people like really realize. Like, oh gosh, I'm going for it. Like going into the room and just with your sensories smelling like the difference between a bloody stool or a C. diff stool. Like, maybe we're gonna get to a point with AI where they can like identify that by smelling it, but like those are things that nursing does. And hey, I fully support robots helping us in being supplementary, but like, unless somebody is unconscious or they're, doing surgeries on them, I'm like, there is so much more that goes into nursing that people like have any idea about. And so that was intriguing
Right.
for me. I was like,
Okay.
they said that and they're like, Sue, AI could replace nursing. I was like, I think we have a little ways, we have further to go. So maybe
Okay.
not overhyped, but
We're on the same boat there, you and me.
yeah.
One thing that every hospital CEO needs to hear from a nurse.
Yeah. Ooh, bring us along in the journey, in the conversations. You know, nursing, historically hasn't had that, always had that voice at the table with what's impacting our work. And hey, I'm going to go back to my mentor and even what we're doing now. It's like, really understanding the end users and where the solutions are. Um, the greater engagement and adoption. And so, especially when it's coming to solving workforce issues with nursing, like we are one of the biggest groups in their systems. And a lot of us, like myself, right? I didn't do this alone. Other nursing leaders helped me create this. And
Yeah.
so, bring nursing, bring them to the table.
Awesome. Last question. One thing that you do for your own health that you swear by.
Hmm. I really try to make sure I get good sleep. I don't do well without sleep. So, and fresh air
Jessica,
and fresh air.
fresh
Yeah.
air and sleep. Amazing.
And my kids.
Jessica.
That's not just one thing. Sorry, Michael.
Well, listen, it's been a pleasure to have you on today, and thank you for just sharing even just those little glimpses of the journey, the good, the bad, the indifferent, the learnings. And for those of you that have joined us today, if you happen to find this conversation to be enlightening, insightful, please, would you mind sharing it, reacting to it, letting us know what stood out for you? And Jessica, you're obviously always welcome to come back to share other
Mhm.
chapters of your journey. I'm glad that things have been going so well. Hope they continue to go well, and I'll see you soon.
Sounds good. Thank you, Michael, for your time. And goodbye, everybody.